Hello and a very warm welcome to our 19th Rare Rev-inar. I'm Nicola Miller, Editor-in-Chief and Creative Director here at Rare Revolution, and I'm supported today by my colleague Becky Pender, who, as always, is working in the background on our technology. Sponsorship for today's Rare Rev-inar has been provided by Blueprint Medicines as part of an arm's length sponsorship agreement. Blueprint Medicines have had no control over the choice of speakers, curation of the webinar, or its promotional materials. And as with all of our Rare Rev-inars, opinions remain solely those of the speakers. The webinar is not intended to constitute medical advice, so please be aware that if you do have any concerns regarding your own health status, please contact your healthcare provider for personalised and tailored advice. Today, I'm joined by two powerhouse women from the mastocytosis world as we look to discuss the importance of nuanced language when supporting families affected by systemic mastocytosis. And if you've seen our recent edition, you'll be aware of the plethora of conditions and issues and challenges the community face. So lots to dive into today. And I'm really pleased to welcome Dr. Deepti Radia, consultant haematologist at Guy's and St Thomas's NHS Foundation Trust London. Deepti is a lead clinician for the chronic myeloid leukemia and systemic mastocytosis service at Guy's and St Thomas's London. So welcome, Deepti.
Hi, Nikki.
Jess Hobart, co-chair of the UK Mastocytosis Support Group, who has channeled her unique personal insights to drive research, education and healthcare provider education, and really to empower patients to advocate for the support that they really deserve. So thank you both. Welcome. I'm so pleased to have this chance to have a chat with you today. So I always like to start by really going back to the beginning and setting the scene. And what I'd like to do is set the scene and unpick really what is mastocytosis and what are the different diagnostic pathways. So I'd like to start with you, Deepti. Can you give us an overview of mastocytosis conditions and what their respective diagnostic pathways look like?
Okay, so that's a difficult one to start with, but it's a massive
Diving
spectrum,
straight
as you
in.
know, when you with the magazine, showing this. So mastocytosis is just an increase in mast cells, but if you actually look at the spectrum, most patients, about 80%, will have mast cells in their skin, and they'll have cutaneous or skin mastocytosis, which is divided into different types. And then of the 20% left off that component, patients will have systemic mastocytosis, which means they have the clonal mast cells in organs other than their skin. Usually we diagnose it by bone marrow, but invariably it's the clonal mast cells are in their gut, their liver, their spleen, and cause symptoms throughout the whole body, not just in those organs that they are in, and can cause end organ damage. And when they cause end organ damage, they become part of the aggressive or the advanced spectrum. So there's a massive spectrum. And the diagnostic pathways, there isn't a clear one. It'll depend on who you see, depends on your symptoms, depends whether it's dermatology, hematology, immunology. So there isn't a standardized diagnostic pathway because every single patient is unique in the symptoms that they present. So I hope I've answered that spectrum initially anyway.
Yeah, definitely. Thank you. And Jess, I know we featured your diagnostic journey a little bit in the special edition that came out, but can you just give us a bit of an overview as to your quite sort of projected pathway? It was anything but straightforward, wasn't it? So can you just give us a bit of an insight into that?
Sure. So when I was in my late teens, I started having upper GI symptoms, so sort of hyperacidity type symptoms. And that's the first thing that I think maybe was mastocytosis specific. But I was always a very allergic kid. I had asthma, I had environmental allergies, but no food allergies. But cats and dogs and that kind of thing. When I was 19, I started getting spots on my skin that were not something I had seen before. And I asked my mom, because I was away at uni, if she could make me an appointment at the dermatologist when I came home. And that dermatologist had just read about mastocytosis, which was lucky. And she said, I think I know what this is. Do you have allergies? And I said, yes. And she said, do you get headaches? I said, well, not really. She said, how about your stomach? And I said, yeah. And so she did a biopsy that day. And I went off to work at a summer camp, as many uni students do in the US, and didn't really think about it again. And then I got a letter from her saying, you do have urticaria pigmentosa, which is what the skin spots were called back then. Now they have another name, but that one's still used. And you should go get a full blood count. And so she sent me off to sent me an order so that I could have that done where I was. And that was normal. And I never heard another word from her again. She didn't give me any information about the fact that it wasn't really just my skin, even though she had asked me about the other things. And so I went on for 3 years, really not knowing that there was anything to be concerned about, and exposing myself to things that now would be huge triggers for symptoms, but not really knowing that my fatigue was probably part of it. I just thought I was tired. And so when I was finished with uni, I luckily went to a GP for just a regular checkup, and she saw my thighs and said, "What is that?" And sent me one step away from somebody who was absolutely brilliant and knew mastocytosis. I was living in Boston, and Brigham and Women's at that time was a big center, and so um, I was super lucky. And the person who diagnosed me on the day I was diagnosed said, I'm quite sure this is systemic, and you are going to have to advocate for yourself, because most times you see a doctor, you will be in a circumstance where you will know more than the doctor. So you better really know your stuff. And he handed me a stack of papers and said, take a look and ask me questions. You're welcome to stay as long as you like, and stop me between patients. And so that really launched me as a patient who could advocate for myself.
So that was really the first time you heard the word mastocytosis, and in that second interaction or third interaction.
Yep. Yeah.
Gosh.
And yeah, I had no idea before that. And he sent me away with my EpiPens, and explained why I might need them, and that I needed to be careful with anesthetics and with opiates, and just began the process of orienting me.
And I'm just interested, just to add on to that, did you feel when you left, and you said you were given a huge amount of information, did you feel when you left then that you knew, like, did you feel quite empowered? Now I really know what this is, or did you feel there was still a lot of unanswered questions?
Um, I think I felt like I had been given, the okay to become knowledgeable about it, but certainly I didn't feel like I knew what was going to come. And shortly thereafter, I started to kind of reach out. The internet was just at its beginnings, and so I was on my own for a bit, but soon after that, I started finding other people to talk to and to share experiences with, and that really helped.
Jeff,
So
can I just ask, when you were given all that information, because some of it can be overwhelming, you suddenly find out you do have the diagnosis, someone who's knowledgeable tells you, and you feel a little bit potentially safer or in a different place from you where you were before. But then when you're given all this information and being told you are going to be your advocate, you obviously are a patient's advocate at the moment. How does that feel? And how would that feel with some, it's different in different patients. How did that make you feel?
Um, I think you're right that not everybody would have liked that, and I think this doctor saw me and for me, and thought this was an appropriate approach. Um, I think I think it can be overwhelming if it's too much, but at the time, there was no patient organization anywhere, there were no materials, there were no other patients for him to refer me to, and so it was sort of, well, I've got these, and she can probably handle it. But having information that is appropriate for, patients understanding, the level of understanding they'll have at the beginning is, would probably have been even better. Um, and I'm also the kind of person who likes when a doctor says what they know and what they don't know. And so I liked seeing the information in the medical journals to see what was known and what wasn't known. Um, but not everybody wants that either, so you guys do have a tough job to kind of figure out the right, you know,
Yeah, but I also am impressed with the fact that that information was given in a busy clinic with a view to don't go away with it, sit here with it, and you
yeah,
can
Yeah.
ask me any immediate questions that come to mind so that if somebody is overwhelmed,
yeah,
then there is an opportunity to feel that you can ask one or two
yeah,
rather than here you go,
yeah,
come back later, or we
It shows great awareness, doesn't it, of that, of that medical professional, to have that understanding that there was a lot for you to take on board and that you were going to have questions coming out of it. So
yeah.
thinking about the clinical side of it, Deepti, you mentioned that there's no real kind of set diagnostic pathway, but in terms of clinical care and clinical guidelines, what is there by way of established sort of protocols and understanding of guidelines for SM?
So what I'll say is that the clinical pathways have got better. You know, we've got to a point where Jess has described where she started, and I would have started as a clinician in 2006, with little knowledge, little paper, and understanding the diagnostics. And then there has been an explosion in information, and now it's about shifting through it and where you shift through it. There are guidelines. There are US-based guidelines, which are excellent, which I tend to refer to, that have been updated. There are ECNM, the European Competence Network in Mastocytosis, which is a voluntary organization of doctors across the different specialties interested, who have an annual meeting. So we come up with consensus guidelines with changes, which also help. UK specific wise, under the umbrella of the NCRI group, we have set up a writing group, and I'm hoping we'll have guidelines available by next year. There have been lots of changes in diagnostics, and every single country has different healthcare approaches. So, you know, having a streamline as to where patients are going to go in a pathway will depend on where you are in the healthcare system you're in and how that's facilitated. And it's looking at how we try and help facilitate that.
And I guess the challenge is because, as you said at the start, it's so multi-systemic. Different patients will present to different people. Actually, making sure that it's the dermatologist and it's the hematologist that all have access to that and know that those guidelines exist.
Yeah, and they will be disseminated, there'll be education, but also remembering that every single specialist will have a different view. I'm not a dermatologist. I've learned a lot from my colleague. And so I think I'm slightly better than I was when I was started. I know the treatments, I've got that knowledge base, but I'm not that person that deals with that. I can titrate and I work well, and that's knowledge by experience and learning from working with somebody. And I think the most important thing is having team connectivity in across the UK. You know, having the different people, the dermatologist, the hematologist that's involved, the allergist or immunologist, the gastroenterologist, you know, having a team. And they don't have to be sitting in the same place, but having those connections. So you phone a friend or reach out to somebody with an interest and knowledge is, I think, the next step of setting up some sort of network. And the guidelines will back it because the dermatologists will have their own guidance of what they do. The immunologists will have their own, and we need to dovetail that in. And I think we're at that point with enough information to be able to do that and move to the next step, I hope.
And Jess, to round off that kind of general picture that we're looking at, in your capacity as an advocacy leader, sort of supporting the wider community, internationally and across the UK, what do you feel the current gaps are, or do you feel there are current gaps in that kind of the care that people receive clinically?
There are some places where people are getting excellent care in the UK that's really well joined up, but the majority of people are getting care pretty close to home, and there won't be a center of excellence there. And it'll be a single clinician who has a particular area that they know. Maybe it's a dermatologist who's really good at the skin part, but they don't think, ooh, we should make sure this patient is having a DEXA scan to check bone density, every 3 years or so. Or they might not have a sense of how to help the patient find the triggers that they have. And hematologists can be terrific, and also some of them might not think about the kinds of day-to-day changes that people might need to make to do better, because they're used to somebody who has a myeloproliferative neoplasm that doesn't have environmental triggers, for example. So they might not have that experience. And an allergist may have other things that they miss. And so, when we travel and talk to doctors, we're always sort of trying to think, where's the likely blind spot? Not that all of them have a blind spot, but where is the likely one if they're on their own? And I think, one that I worry about a lot is when an adult presents with skin spots and isn't treated as if they are likely to have disease. That really worries me, because we have examples of people who, for example, weren't given EpiPens, and we have situations where we know that patients have not survived anaphylaxis because the dermatologist didn't connect the dots and
Yeah.
say, ooh, this patient could have anaphylaxis. I got to make sure they're ready.
I know that's what really struck me working on the edition was the diversity of the triggers. I think, understanding those could be allergic and non-allergic and just the wide variety of things. And I think for people understanding that, must be an incredibly challenging part. So having people that can help guide you through identifying what those triggers are, or at least making good assumptions around what they might be, because I guess it can never be completely precise because, they're so varied.
And I think one of the challenges with that is, apart from our kind of specialist views, which we need to open up those blinkers and connect. And I'm hoping that's getting better. But it needs to be improved. It needs to be improved, and we need to continue doing what we're doing so that we uplift the treatment and the management that's been done across and try and make it level. It
Yeah.
takes time. But the second part of it is also every single patient is unique at different points in their life. So there is this kind of journey the patient goes through. And I think for me is with knowledge and experience, you get more experience. So, I've had that. So it's easier for me to have that conversation. It's not necessarily easier for another colleague who's learning, but also is empowering the patient to recognize those triggers because every single patient is unique. And at another point in their life, they'll have another trigger. And actually, it's empowering that patient to think this might be a trigger. I think, Jess, as you did when you saw that first clinician, that, hang on a minute, gut is part of this. And then I need to think about what my triggers are. I think that's really important. I think that's a joint journey. It sits predominantly with the clinician identifying these things, but the patient then starting to recognize them because they're walking that walk and then walking together. And I think that's really important.